Serving all of San Diego, this is your Fox 5 News.
Okay, so this is a new way to contour the body, but without really have to be put under. So we'd like to welcome Dr. Brian Reagan and Dr. Kira Polsky from True Beauty in Carlsbad to tell us all about, it's called Tickle Lipo.
Tickle Lipo. Good morning.
Good morning. Thank you for being here. What is Tickle Lipo? We heard about this yesterday and everybody started giggling.
So Tickle Lipo is nutational infrasonic liposculpture, and that's a long phrase. Essentially what it is a new way to do liposculpture. What makes it different and what makes it better is because of the unique properties of this wand.
Is this it?
This is it. This is it. You don't need general anesthesia. The sensation you get is a vibratory sense, kind of like a tickle. So the great thing about this is no general anesthesia. You don't need to go to sleep.
I like it. I think we have some video. Oh, we are showing some video. Do you see that from over here?
Yeah.
Is that like a procedure happening?
It is.
And then so the patient is awake.
Patient is awake, and that's very different than the way we traditionally do liposuction.
We give them medicines to make them feel loopy, so they don't feel uncomfortable. Feel like you've had a margarita.
But you're wide awake. Your eyes are open.
You're wide awake. You can follow commands. We pump you full of dilute anesthetic, which sits in the tissue sometimes for up to 72 hours.
Okay.
Which means sometimes you don't even need to take a pain medication afterwards.
Really?
You're up and moving, walking around the block right afterwards. We encourage you to exercise afterwards.
Which is different than traditional liposuction, right? Because if you do lipo regular normally, you're out for
Shelley,
a while,
we think
right?
it's actually safer.
Why?
When you do general anesthesia and you're lying still and you're doing a procedure, there are certain risks that come into play that don't come into play when you're moving. Things like clots in your legs. So these patients are up and about. They're moving during the procedure a little bit, and then afterwards they're up and about right away.
So patients say the reason it's called tickle is that it's like a vibrate. So this is like, I don't know. How would you describe it?
We'd like to show it to you if we
you can. You're going to show it?
So we're going to show it to you.
Yeah.
So
That's
you
what I'm
can
talking
see.
about. Okay.
So
you're picking that up, but it vibrates in such a way that it tricks the pain nerves from being able to tell you that it hurts, and so you sense this vibration, and you don't sense the pain.
Do you know what I think that reminds me of? Maybe tell me if I'm wrong, if I'm not correct in my description, but you know those toothbrushes that you just...
The Sonicare?
Yeah, that it just vibrates. So that's the kind of sensation that you're getting. Okay.
Yeah.
So it's not painful. Does it bruise a lot?
Less bruising than traditional liposuction because of the way this wand moves. It is selective for the fat and it spares the other structures like blood vessels. So less bruising, less swelling, quicker recovery.
Okay, I gotta just poke a little fun because it's just gonna be Tracy model. Come on in. She's in a bikini. Yes, I know it's cold outside, but it's actually not that bad. She's doing it though to show how, Doctor, you're gonna show us how you mark up in what areas. So how does this work?
So on Tracy, she's a perfect candidate because she's in good shape. She just has a few localized areas that we could touch up and get rid of this little excess fat here, upper and lower abdomen. We never want to do just the lower abdomen because you could have a little roll above it. Okay. So we kind of go towards the major areas. Then we'd also do the flanks, extend it around, twist this way a little bit, thanks. Around here to get the flanks. And she doesn't really need lower back. Some people have a little roll there too we can get, but we bring it down and around and we can extend it down however much you need, but that's kind of what we do on one side. And then with her, we've also talked about doing her inner and outer thighs.
Oh, so you can do legs, like just where you would do normally?
Absolutely.
Okay. Yes, so we can even bring the inner thigh down to the medial knee. Now Tracy doesn't really need it there, but some people have a little bit of fat kind of right down here, and so we can extend it down and get that fat too.
What do the incision marks look like? Are they,
we hide them down. We can hide them below the bikini line.
And they're tiny little holes, smaller than that. Tiny little holes, well hidden.
Huh. Fascinating. Okay, now I got to ask the magic question because I know people at home are wondering how's the pricing compared to regular liposuction?
It's going to be cheaper because you don't have the cost of anesthesia. So. Pricing is traditionally about $2,000 for the first area, and then it goes down as you do more than one area. And I'm the first plastic surgeon in San Diego to have the Tickle Lipo. So you can find us at True Beauty, and we'd be happy to talk about it.
So the pictures that we have up and we're showing our friends at home and work right now, those are before and after pictures, right? That's a significant difference.
Those are good examples of what you can expect. And the important thing here is that liposculpture is not a weight loss technique. It's a refining, it's a sculpting technique.
Okay, so you kind of want to be in good shape. I mean, if you got like, what, 10 pounds-ish kind of fat that you want to lose, this would be good?
It's perfect. Tracy's a good example. Someone who works out, tries to watch what they eat, but they just have some stubborn areas.
Well, sweetheart, you look amazing just the way you are. I just want to say that out loud. Dr. Reagan and Dr. Volsky, thank you so much.
Shelly, thank you.
By the way, if you'd like to learn more information about Tickle Lipo, we put it up on our website for you, fox5sandiego.com. You just got to click that little red button that says Seen on Fox 5. Good to see you guys. We'll send it back over to you guys.
I agree with Shelly. She looks great the way she is. Okay.